So tell Gabby I said hello.
Well, Gabby's the one that told me to call you.
Gab's my favorite. Yes,
I get that a lot. She's
Everybody
the
loves
best.
Gabby.
she is.
Everybody loves Gabby.
Yeah.
And she's the one that really will tell me who to call for
Okay.
this. Because she knows, you know. So that's why she said, call you, great personality, fun.
Yeah, you don't want to. You don't
Well,
want
you
to.
can mention her too. Mention anybody you want.
Okay.
You can mention Dr. Vibert. You can mention Pure Dental. But mostly what I want you to mention is Forever Smile. Because that's the name we're trying to really...
Forever Smile.
Yeah,
Okay.
so just when you got your when I got my Forever Smile, or when I woke up with my Forever Smile, I just so we have that in
Okay.
there. I love my Forever Smile kind of thing.
All right.
So, because we,
I got it.
so how fun that you play. You live that life. Do you play every weekend or usually? Or no?
Well, we're not gigging now, but we practice every week.
You do?
Last week we practiced 3 times. Yeah.
At the drummer's house?
Yeah. He's got a little studio in his garage.
So my son's a drummer, so we always had the practice. Of course, he had bands, and always my house was the practice house. So.
Your son plays drums?
Yeah, Corey.
That's cool. I play guitar.
Oh wow. Huh.
I bought a banjo a couple years ago.
You
too, and
did-
I'm
I
trying
love
to pick it up.
banjo.
It's hard, man.
It's
like a
very
whole
hard.
nother
My very
style
first
of
boyfriend
playing.
Yeah.
played banjo.
All right, we're good to go.
Very hard.
Even though there's only 4 strings, there's a lot of sound.
Yeah, it's
Yeah.
a whole different picking method.
Yeah, right. Yeah, I play a little guitar, but that's just for myself.
Yeah, it's fun. I don't play in a band. I've always played for fun. All right, we're good.
Feel good? Good to go. All right. So let's just start out having you introduce yourself and tell me where we are and what your life is about.
My name's Ed, and you're in my house right now. And so I've had a whole life of lousy dental experiences. I have had pain, and it always happens when you're on the way to the airport. Okay, it's like New Year's Eve, and your veneer falls off, and where you're going to get a dentist. And I believe me, I've had that several times in my life. Or you're going somewhere, and all of a sudden, your tooth starts getting loose, so you're afraid to chew. So I've had teeth loose. I've had them fall out. Haven't had pulled, and then you have to have, a post put in and a crown, and you have to go 2 or 3 times. And to me, time is the most important thing. So Forever Smile was recommended to me from my neighbor's husband. And I happen to know Dr. Vibert for many years. He went to school with my son. And I remember him as a really bright kid. I mean, I think he worked for IBM when he was in high school. So I went. I took my wife with me. And I thought she was going to say, forget this. But after the consultation and speaking to him and seeing the technology and the science, I was just blown away. So he gave me the whole rundown, and I said, how can I not do this? I have to do this because it's one time, and you're done, and you're out. And that's what impressed me the most. Just the X-ray machine blew me away. And everybody's so professional there. So that's why I did it. And it's life-changing. Not everybody, but people I speak to say, your teeth are so straight. What happened? I said, well, they're all fake. I don't have any real teeth in my mouth. And people are just amazed by it.
Yeah. Wow. Excellent.
I'm in the men's room because I have to use a water pick, right? So I'm in the men's room. I have a water pick everywhere I go.
At work.
At work, I have a place upstate. I have a water pick. I have a water pick here. So I'm in the men's room, power washing my mouth, and a guy's washing his hands next to me, and he's like, "What's that?" And I said, I have to clean my teeth. He goes, "Yeah, your teeth are so nice." And I said, then they're all fake. So I had to give him the whole story, you know what I mean? And then people say, oh, one of the women that works for my daughter in my office, I told her, I had my teeth done. And she goes, well, where'd you have it done? And I said, Forever Smile. So I gave her a business card. I recommended Dr. Vibert, and I don't know if she followed up, but yeah.
Excellent. Well, thank you for that.
Yes.
That's awesome. You have a great voice, by the way. Great voice. I love when you project like that. It's really resonates. So that's awesome.
Thank you.
Well, thank you for that synopsis. I'm going to go back and just kind of break it down a little and ask you. You had talked a little bit about the problems you had before with your teeth.
Right.
It was upper and lower,
Right.
correct? So you had a bunch of missing teeth.
I think I only had about 22 teeth left at the time. So the left side of my mouth, I had I didn't have any on the bottom and the back, only a couple. So I had to chew on my right side the whole time. So obviously after you do that, you're going to put more wear and tear on those teeth. What made me go there was there was one tooth that was starting to get loose. And I mean, I've experienced this, so I know exactly what was going to happen. Once it starts getting loose, it's never going to get back to normal. So I said, I can't go through this because I have to have the teeth pulled. That's one day. Then they put as I said, they put the post in, and then the crown, and then you got to go back 2 or 3 times. And you're spending $3,000 or whatever it is. So I said, there's got to be a better solution. So,
The dentist that you were going to, did he come up with any other solutions for you?
as far as dentists and me, I've had really bad experience. Well, maybe it's me because one of my dentists committed suicide. One of my dentists quit out of the blue. And so where do you find a dentist? And my last dentist, I went to some group, and I just thought they were very unprofessional, and you're dealing with somebody different each time, and I just wasn't happy with it. I said, I can't keep doing this.
Did you have any implants done, or?
Never. No, I've only had some posts and crowns.
Okay,
That was
so
it.
they never suggested implants to you, or?
I don't remember. I don't think so.
But it was just a mess, and you were like, I need some kind of solution for
Right.
this.
Because, I mean, I'm getting older, okay? And I'm getting into my late years in life. And I have a really intense gag reflex, okay? I don't think I could ever put dentures in my mouth without, I don't want to live like that. My father had full dentures, and he was miserable. And I didn't want to live like that. I mean, also, I'm sorry, my mouth's dry. Eating.
Right.
I was limited by what I could eat. I could not eat corn on the cob. I couldn't bite into a bagel. So you go out to eat with people, and I'd have to choose something soft all the time. Well, everybody's eating like a steak, you know what I mean, or something like that, and I couldn't eat that. I'd have to eat fish, or I'd have to eat something soft.
Yeah.
And it drove me crazy.
It drove you crazy.
Right.
Right. So you missed all those foods, and also, it's not as healthy to eat those soft foods when you can't eat vegetables and crunchy
Right.
salads and things
Exactly.
like that. So it messes with your digestion.
Right.
So, and you mentioned dentures, because a lot of people, this is a great procedure for people who have dentures that don't want them anymore. And they really do not need to, people do not understand, they don't need to have dentures when this is here. Like there is a solution.
Right.
So our job really is to get out this information, because people don't know about this procedure. They just go like you to any dentist and maybe get an implant or two, but it's an ongoing, lifelong, expensive, painful, time-consuming
Right.
process.
What impressed me is you go in the morning, 3 hours later, you wake up and you have a full set of brand new teeth. It's unconscionable. It really is. In the beginning, obviously, they have to heal, so you have to watch what you chew, obviously. But after a short period of time, all of a sudden you're experimenting, and you're starting to eat things, and it's like 2 months ago I couldn't eat that. You know what I mean? So now I can eat anything I want. But so the other good part of it is you have to watch what you eat. So I started eating soup. You know, I used to eat like a sandwich every day for lunch or something like that. I started eating soup. I started eating oatmeal for breakfast. Instead of like fried eggs and bacon on a roll, I have oatmeal. All of a sudden, I start losing weight. And I'm like, this is amazing. You know what I mean? Because, you know, I mean, you get to my age, it's hard to lose weight. I don't exercise a lot. So all of a sudden, your whole eating habits change. You start eating more healthier, and you lose weight, and you start feeling better. And it's like all of a sudden, this is amazing. I lost like 15 pounds in about 5 months, which I could never do, you know. And that was the other, you know, the good part of it.
Yeah.
Yeah.
So it's not just the teeth. It does a lot more.
Oh, it's your whole
Having
lifestyle.
Forever Smile does a lot more than
Oh, yeah.
just give you a nice smile. What did it do for your confidence or the way you smile at people?
I happen to have a lot of confidence in myself to begin with, but I was always embarrassed about smiling. And when you talk, you know, my whole profession is talking to people. That's what I do. I talk to people. And I would find that I'd be talking to people and I'd be like, you know, covering my mouth, or I'd be altering the way I talk to hide my teeth because I'd be so embarrassed for my teeth. Some of them were fake in the front and the colors didn't match. And it was a mess. My whole mouth was a mess. I'd be embarrassed. I was embarrassed to go, to tell you the truth. And I'm sure he saw worse than me, you know.
That's a big thing. I definitely would love to talk to you about that because a lot of people tell me when they go to other dentists that they're made to feel less than or embarrassed by their smile or like they're not clean because they didn't clean their teeth. And I'm like, I cannot fathom this. How do dentists do that to make you feel so bad? And it's really does happen out there, and I can't believe it. So they were all like, when we came to Forever Smile, we did not feel that.
Mm-hmm.
It did not make me feel bad about my teeth. So that's a really key thing. I just can't believe that you're made to feel like that when you go to a dentist to help you with
Right.
with the thing that you're walking in with, which is really crazy.
Which is another thing about Forever Smile. They do make you feel good. They make you feel comfortable, and the future is there. You know what I mean? There's light at the end of the tunnel. It's like when you go to a dentist, you know, you have a filling, you do this, you do that. Well, another year later, you're gonna have another problem. Here, this is it. You're done. You're done forever. You don't have to worry about it. You know.
That's the best part.
Yes.
Not only are you done in 3 hours, but you're done for life.
Right.
Except for cleanings.
Right.
You can eat what you want, smile.
Yeah. So it's unbelievable.
It's unbelievable. I like what you said, that you walked in there and you thought it was the future.
Mm-hmm.
Because
I was blown away by the office, just walking in. Everything is so modern, so clean, everybody's so professional. And then the equipment, it's like futuristic. To me, it's futuristic. I mean, you know, you could see everything happening in the screen in front of you. And it's comfortable. Yeah, the other thing about going to the dentist, nobody wants to go to the dentist. I'm sorry to say, but, okay? Here, I don't mind going. Because it's always a pleasurable experience, which is insane to me. You know?
that is insane.
It is.
Did you see the dental lab? Did he take you in the back to see the dental lab?
I didn't see the dental lab.
The
And that's
investment.
Min, right?
And Min,
Min does that. I met Min. Min's the main man there, man.
Min is the
Min is
man.
the man. Yeah.
Yeah, he controls the spaceship for sure.
Well, one of the last times I was there, you know, I guess he was following up, or I had, you know, you have a couple of temporaries and until you get your finals. And I have to say, the first time they put my teeth in, you know, I'm like, I always had an underbite. My whole life I had an underbite. I don't know why.
Okay, that's not.
Yeah, like, you know, my bottom teeth, you know.
Came out.
Yeah. My whole life I was like that. So Dr. Vibrant wants you to have a normal looking set of teeth. Not only that, the shape of your mouth and your face. So he first put in the teeth, and I smile. I look at it, and I'm like, they were like buck teeth. You know what I mean? I'm like, this is like crazy. I can't look. I can't look like this. Okay. I'm 68 years old. I've been for 68 years. My mouth's, you know what I mean? And he says, you want me to adjust it? And I said, yeah, well, can you? I said, because I feel like I have buck teeth. You know what I mean? And he said, no problem. And how do you want them? And I said, well, I like them a little closer, more natural. No problem. So he goes, I'll do that. I come back, and he adjusted them, and they were perfect.
See, that's the beauty of having the dental lab right there.
Right.
Because if you go to another dentist, they take the impression, they send it out, and they write notes. Do this, do this, do this. And so the lab technician is following the notes. This way, lab technician's right there. The screen is right there. And the doctor is able to go back and look at the screen and make his adjustments right then and there. Mm-hmm. So, and because everything is digital, which we're the first ones to do 100% digital, the margins, it's blown up thousands of percent. So everything fits and because of the digital technology. So,
well, that's what I asked him when I after the surgery. He explained that he pulls all your teeth, drills holes in your bone, and puts the implants in. So I said to him, I said, I can't fathom how it fits perfectly, because you're drilling like freestyle. Okay, I joke, you have a Craftsman drill you're using, you know what I mean? And then how do you get the screws to match? But the technology is unbelievable. It's when you scan, it's going to be exactly the same way. So.
Mm-hmm. And the 3D panel you said you had.
Right.
So that gives you the whole bite. Did they do a face scan on you?
I think so.
So you could see your face with the actual teeth in them.
Yes.
And that's very cool.
Mm-hmm.
So.
But I like the before and after pictures the best, because I took pictures of my mouth before and if you saw the before pictures, you would throw up. I tell you, my teeth were disgusting.
You know what? I know you think that. Yesterday I did how many before and after little videos?
Oh, yeah.
And I just spent hours in the morning looking at all of that teeth. I'm like, oh my God.
So I can imagine.
It's genetic for a lot of people,
Yeah.
Right.
Too, so.
You might think yours was the worst.
No, I'm sure there was once, but I was like embarrassed. Is it the 360 X-ray thing?
Yeah.
But yeah, and they showed up on the screen, and I'm like, yeah, they show the whole mouth, and I was like, oh, this is disgusting. This post showing up, and that was just bad.
So just to let you know, they don't use a Craftsman drill, and they're perfectly placed. They're planned to the millimeter where those actually go.
They have to
Advantage of
be,
bone,
yeah.
And that's why they're able to do implants where people don't have a lot of bone, because they're able to do sideways implants.
Right, they're going in on an angle.
Yes.
Right.
Yes.
So,
So no, it's not willy-nilly. It's
no, that's what I'm saying. It really, it's
meticulously
unbelievable.
planned.
Yeah.
The placement, that's a huge part.
I asked him if he could put give me a diamond on one of the teeth, but he didn't want to do that. You know what I mean?
You won't be Dr. Mike.
Or can I have a gold tooth?
Really?
Yeah, she's one of our dentists in Buffalo.
Oh, that's why she
Diamond on
magnifies
her front
everything.
teeth.
She does. Yeah, that's I guess the new
Because she
thing.
can, I guess.
Right.
Oh my God. Okay, so life was miserable with your teeth, as expected. Couldn't smile, couldn't eat what
And
you
there was
wanted.
pain, uncomfortable pain.
Infections? Did you have infections?
I get it. I eat popcorn. I know you're not supposed to eat popcorn. Well, me, because my gums were terrible. I can't tell you how many times I've had the gums scraped. Okay, because there was bone. You're losing bone. There's bacteria, so we have to scrape your gums, and that was you had to go to a periodontist to do that. The dentist wouldn't do that, and they'd numb a quarter at a time. I don't know if they did the whole mouth at one time. They couldn't do that. I think they do like a quadrant, but it was so uncomfortable. And how long does it last? I mean, that's. You have to keep going. If you have that kind of problem in your gums, it's never going to go away. So you have to keep going.
To just maintain it.
Right.
So it doesn't get worse.
As I said, the pain, you never know when the pain was going to start. Or you'd bite something and I would popcorn, I'm sorry. So I knew I wasn't supposed to eat popcorn because the thin stuff gets in between your gums. So I went to the movies, I had popcorn. 3 days later, abscess. And I don't know if you've ever had an abscess, but very painful. And they have to go and you have to have that taken care of, you know.
And you know what? It's so bad for your body to have infections in your mouth.
Right.
It's all connected.
Right.
We just did another testimonial a few weeks ago, and this poor girl, she had such bad infections that her whole body was sick.
Uh-huh.
Because it does. It's your body. If there's an infection in your mouth, it's right in your bloodstream.
Right.
And for years, she didn't feel well and felt the effects of having an infection in your body. It's really bad. It's bad for your heart.
Mm-hmm.
So, now she's like, there's no pain. There's no infection. There's no pain. And that was a huge health reason to do
Right.
that. So
Because with pain, not only you're uncomfortable, but it's stressful.
you found out about Forever Smile through a friend, you said, or a friend's husband?
My neighbor is a dental hygienist, and her husband I think he had just had the tops done, or the bottom, whatever. And she was very impressed. She said, go to Forever Smile, just to have a consultation. Because she knew I had lousy teeth. So I did. I called up, and matter of fact, I didn't know that Dr. Vibert was Forever Smile until I went there and I saw his name, and I'm like, I can't believe this. I know him. And he remembered me too, obviously. So yeah, I was blown away. The initial consult, and after he sits down, we talked. I asked him a lot of questions because I'm very concerned. I mean, is this the right thing to do? Because once you do this, that's it. And after the 15, 20 minutes we talked, I said to myself, I have to do this. But I had my wife with me, and I figured, let me ask her. He stepped out. I said, I want to talk about this. I said, what do you think? And the first thing I thought, she says, there's no way you're going to do this.
Why do you think she would say that?
Just because it was too unbelievable.
Extreme.
It's just, it was like, this is, how could you do this? I really, some people couldn't believe that this is possible.
So she didn't believe that it was possible.
No, I thought that she would feel that way. So in my mind, I said, I got to do this. So I asked her, what do you think? And she says, yeah, I think you should do this. And I'm like, amazing, let's do it. Let's do it.
Wow. What was your biggest fear going in there? Not before
That
the
it wouldn't
surgery,
work.
but that it wouldn't work.
That I'd end up having to deal with dentures or some other solution.
Like they're going to pull out my teeth and now...
And then, what am I going to do? I'm on the street now with nothing. You know what I mean?
I'm naked.
I'm done. I have nothing, and that's it. And how do you can't regrow teeth. I mean, as lousy as my teeth were, you still need teeth. You know.
Still had some.
Right. I think I had 22 left.
I think that would be my biggest fear too. Like you're going to take out all my teeth and then what if it doesn't work?
What if it doesn't work? Because, you hear these stories. Again, implants have been around, I don't know, maybe 20 years or so. And then back in the day, I guess they were new. People, they didn't hold or what have you. But the Forever Smile approach with the angled, implants that add strength, it really sold me because it makes perfect sense. It's such a simple solution that makes perfect sense.
That's good.
Yeah,
I like that.
I can understand that. And he explained it to me, and I said, yeah, this is good.
So once someone explains something to you, you understand the process. And he told you there's like a 99% success rate or something. Like it's...
Whatever it is, yeah.
They don't fail.
Right.
I mean, I'm sure somebody, whatever. But it's a...
Well, it depends on your lifestyle, too, If you're going to smoke 2 packs a day and drink, don't expect your teeth to... You know what I mean?
Right.
Yeah,
Even after you get these, not supposed to smoke.
Well, that's what I mean. You have to take care of your mouth.
But you're doing great with that 3 water picks you own.
I power wash my mouth all the time.
Did you ever use water pick before?
Never. I never even flossed. Are you kidding? Maybe that's why my teeth were so bad. No, I think my teeth were bad because genetics and lifestyle. Okay.
So, that's pretty much.
But my most of my family had lousy teeth, and I knew, well, that's it. That's the future. You get into your 60s, it's like, there's no way I'm going to wear dentures because I gag like crazy.
And you can't taste food.
Right.
It's a
I
mess.
guess. Yeah. I don't know.
It's a mess, and they hurt, and it's an ongoing procedure of getting them realigned and all that. Okay, so we get up to this. So now you're all ready to go, and were you nervous about the surgery?
Of course, I was nervous.
What were you nervous about?
Well, they're going to knock you out. Am I going to wake up? Is it going to work? I mean, are they going to match? They're pulling all my teeth out. They're knocking you out for 3 hours. When I wake up, what's going to happen? There's a lot of questions. Of course, I was a little nervous. But
Did you know you were going to wake up with teeth in your mouth?
I think they explained that, yeah. I think he said after, they knock you out, and if you knock you out, they're going to do whatever they want to you. Okay. You know what I mean?
The Seinfeld episode at the dentist.
Oh, I don't know. I don't know
Oh
that.
my God, the dentist is like having an affair with a nurse or something. So as Jerry's like,
Oh, yeah? Okay. He's
taking off her bra. It was really funny.
Really?
And he's asleep, but he's really not asleep. Really funny.
Yeah, of course. They're going to knock you out. Am I going to wake up?
So
And what,
you met the anesthesiologist.
Yes.
Did he make you feel comfortable?
Dr. Albani. Yes. Yeah, she explained everything to me.
So that made you feel comfortable with that?
I was very comfortable. And, well, not only that, I'm a night person. I don't like to get up early in the morning.
Of course, you're a musician.
So they do this surgery like so early in the morning. I mean, I'm not even half awake, and dressed like in comfortable clothing, so I'm wearing like a sweatshirt, old jeans. I look, no contacts. I wear contact lenses, so no contacts. So I look like a bum. I didn't shave. You know what I mean? I had like 3 hours of sleep. And I go there and, it's like so early in the morning for me. It's not me. And they explain what they're going to do. And I'm like, yeah. And all of a sudden, you're out. Next thing you know, I hear breathe through your nose. And, you wake up and you can hear some stuff going on. You can hear talking. And I guess he's doing the suturing at the end, whatever. And then they screw the teeth in. And they give you a mirror. And all of a sudden, it's like, I can't believe this. It's unbelievable.
Your forever smile.
My forever smile is perfect. It's beautiful.
Too funny.
It's the truth. It really is.
So you looked in that mirror, and what'd you say?
I saw beauty.
I'm a good-looking man. Yeah.
I'm looking really sharp here. I can talk to people and smile now. Yeah, that's what Forever Smile does. Yeah, it changes your whole life.
What does Forever Smile do?
It makes you a new person. It changes your life. It really does. No more pain. No more uncomfortable feeling talking to people. You can eat whatever you want without thinking about it.
What's your favorite thing to eat?
Oh, I don't know. I eat a lot of different things.
You a steak eater?
I'll eat a bone and ribeye. Yeah, of course. Yeah, I'll eat a nice bagel.
Were you afraid of any pain? Were you afraid of pain?
I wasn't really afraid of pain because they're painkillers. Okay. And I even asked him for a specific type that he prescribed to me. So pain was not an issue to me. I knew. I had a mouthful of pain for years, so.
And how was the pain level when you in the recuperation?
Not too bad. I was a little uncomfortable. I don't remember having like pain. I had throbbing maybe a little bit. not enough to keep me awake. But you take a painkiller, or Tylenol or whatever. And that was a couple of days.
That's it. And then you were okay, good to go.
I was fine.
So, because a lot of people think, I'm going to be out of work for a week, 2 weeks. I'm not going to be able to function. This is a big thing.
You have to remember, I had not a lifeful, but I've had plenty of pain in my mouth. As I said, I only had 22 teeth left at the time. I was losing teeth. And it always happened at the wrong time, on the way to the airport. New Year's Eve. I remember New Year's Eve one year, it was like 2 o'clock in the afternoon. Oh my God, I'm trying to find a dentist. What do my dentist is like away in the Bahamas or something for vacation. So pain I have experience, and I had, having a lifetime of pain, oral pain, you develop some type of tolerance to pain. You get used to it, okay? So this is like, I wasn't afraid of the pain. I was really afraid of, is it going to work? Is this going to really work, or is this too good to be true? And I had to tell you, it is. It works. It works. Forever Smile really works. It does.
When did you realize it's going to work? Because that was your fear.
It took a little while because in the beginning you can't chew. We eat soft foods. You have to let everything heal. And then you start experimenting. You get permission. Am I allowed to eat this? I go, Dr. Viber, can I eat this now? Wait a week, then start. And it's like, can I eat now? You go, eat whatever you want. And for a couple of months, I wasn't eating whatever I wanted because I wanted it to last. You know what I mean? I wanted it to work. So you start experimenting. And then all of a sudden, you find yourself eating corn on the cob. I used to have to cut the kernels off the cob to eat corn, okay? Or anything, So it's probably a month or two. You realize there's no pain. You can eat things. And then you start experimenting. As I said, then you can eat it wherever you want.
That's amazing. And you know what people say, you have to eat soft foods. Well, you've been eating soft foods before this.
Right.
What's another couple months of...
But I said that one of the benefits was the weight loss that you don't even think about. I don't know if every patient, experiences that, but I'm sure a lot do.
Yeah.
So then now you're accustomed to eating different foods, healthier foods, softer foods, and you start losing weight. So now it's like, why am I going to go back to eating garbage? Because now I feel better and I lost weight and I can live like this. So let's continue to live like this, which is an amazing, side benefit.
Wow. Well, because you look awesome, so apparently you have kept it up.
Mm-hmm.
Wow. So
I know you're lying to me, but
I do not
I used to be 300 pounds. Now,
No. I don't lie. I just wouldn't say anything.
Yes.
But that's amazing. Okay, so that was the recuperation, and we certainly heard what life is like for you after.
It's unbelievable.
Do you think about it every day?
A lot. Not every day, because you get used to it. But I mean, you got to power. So after you eat, you have to wash your mouth because some food gets stuck up there. But that's what the water pick is all about. My mouth has never been cleaner. Okay.
And that's a good feeling.
You power wash your mouth 3 times a day, it's going to be clean. Okay. So of course you don't have. I don't know if I ever had bad breath, but you're not going to have bad breath anymore. Yeah, and not only that, I used to get stuff stuck in my teeth. You go out to a restaurant, you're eating, and it's like you can't clean your teeth at the table.
Right. So it's a cleaner feeling.
Right.
Awesome.
Matter of fact, I was at a wedding about a week or 2 ago, and I'm in the men's room washing my hands, and there's a guy, and he's got like a toothpick or something, and he's like cleaning his teeth, and he's like, I said, I don't need one of those. He goes, what do you mean? I says, I don't have any teeth. And I smile. I said, I have no teeth. I said, I have full implants. And he's like, that's amazing. He goes, so we start talking teeth in the men's room at a wedding. And of course, I recommended Forever Smile. I said, you got to call him. This is amazing.
Oh, he had issues.
He had issues.
Yeah. That's awful. And that becomes.
And you know, I've talked to people. They've had an implant, and they have bad teeth. They're going for another implant, and I'm like, well, I got all of them done at one time. It took 3 hours. You're in, you're out, and it's amazing. So that's Forever Smile. Yes.
I like that.
Awesome.
That was perfect. That was really good. Quick, to the point. What is my final question?
Have you spoken to my agent, by the way? I don't remember. Okay.
That's
SAG-AFTRA. You didn't tell us.
Okay.
I was just gonna ask, what do you, what would you tell me if I was on the fence thinking about doing this, but either I was afraid or I don't think it's gonna work, or for any other reason, when there are many of them that people are afraid to do this? That's what would you
It's
say
simple.
to me?
Think about the alternative. You have a problem with your mouth. You're losing teeth, or whatever your gum problems, and you've experienced this, so you know what you have to go through. If you do this, that eliminates everything. No more pain. It's one session. 3 hours, you're in and out. Obviously, there's a healing process, but any dental work is a healing process. So what's the alternative? You want to keep doing this because your teeth are never going to get better. You know, the older you get, depending on your lifestyle, you're not going to regrow teeth. What's the alternative? You want to keep going through that process every 6 months, or whenever your teeth, you know, whenever you hurt. This is a one-shot deal. Do it. Just do it.
Oh, great smile. That was a beautiful smile.